Mr. Smith, what level of income would you say would be appropriate for people to be able to qualify for Medicaid?
It's a great question, and it's an important one because I think it's a discussion that Washington missed out on, which is who should Medicaid be for? People think of people in poverty being eligible for Medicaid. But the irony over time, as Medicaid was expanded, you have some people on Medicaid who are not in poverty. They in fact have higher income levels. And you have poor people, childless adults, who are not eligible for Medicaid whatsoever. I think it's the federal law requires states, if they're going to expand, requires them to expand all the way up to 138% of poverty. I think Medicaid is for people in poverty. I think, though, the opportunity is to help people in a glide path back into fully participate in the workforce. So while you may have people up to 138% of poverty, charge them premiums, charge them cost sharing. Do something that helps them to understand that Medicaid is not free for them. It shouldn't, having Medicaid there will help them if they have chronic health conditions, they have a health problem that they need to be able to address so they can go back to work. By all means, let's do that. But let's also give them some responsibility in their own health.
In other words, Medicaid is a means to something else. It's not just, unless you've got a catastrophic situation, it's a means to get you through a tough time until you can take care of yourself.
Most people on Medicaid are healthy because they're kids. So half the population in Medicaid are kids. Their parents are not eligible except at very low income levels. They are responding to the way policymakers have created these programs. And they understand in many respects, if I earn too much money, then my child may not be eligible. And for a child with a health condition, that's a very difficult position to put that family in. So again, that's why I talk about we need to recreate these programs. I go back to, this is the 40th anniversary of Ronald Reagan's blueprint for welfare reform that catapulted him into the national conversation when he was governor of California, and he put out the blueprint for welfare reform. And his reforms were on food stamps, the old AFDC program on Medicaid. Ronald Reagan didn't say repeal these programs. He said let's fix them. And the idea of fixing them is to help people to go back to work. But Medicaid relies on the old system of saying, you're just in poverty, you're gonna stay in poverty, and the rules require you to do nothing. We should be now saying, what can we do to help you that Medicaid is temporary, that it is there if you need it, but we're gonna help you with your healthcare condition so you can go back to work, so you can fully go back to work. And that's what the conversation needs to be talking about.